Hello everyone! In today's video, we will be discussing family history and genetics and blood pressure. It is important to know that family medical history does play a role in developing high blood pressure, and it also helps when managing, to have that blood pressure in a normal blood pressure range. I'd like to start off with a question for you all today, just to kind of get us going and, have you a little active in this video today. How many of you know a family member who had or has high blood pressure? Um, I can answer this. I actually have a few family members that do. High blood pressure does run in my family. So at my age, at 26, I am often kind of conscious about, the sodium intake I'm receiving and just trying to make sure I am being as healthy as possible because at a young age, I just don't want to develop any recurrent health conditions that run in my family. How about anyone that knows anyone with low blood pressure? Or simply, you just may not know anyone at all, or you're just unsure, and that's okay. The purpose of this question was just to get you thinking and just, have you active. Now, someone may ask, what is family medical history? So, we've all been to the doctors before, and everyone knows when you go to the doctor, you have paperwork to fill out. And sometimes in that little packet of paperwork, there is a medical history form. And that medical history form will ask you about your current medical history along with family medical history as well. And it's very important that prior to medical visits that you know your family medical history because oftentimes family medical history plays a role in your current and future health histories that will come. And what I mean by this is, I mentioned in the last slide with my question that I have a lot of family members that do have high blood pressure. And recently, when I went to the doctor, mine was a little bit elevated, but I do think it was due to stress from school. But at the same time, it made me more vigilant of how I need to watch what I'm eating and also make sure I'm exercising enough so that I can keep and maintain a healthy weight. It just makes you a little more conscious when you get those small wake up calls. Now, the purpose of the family medical history is this is a record of any disease and health conditions that people in your family have had or currently have. And this is useful for understanding health risk and how to prevent certain health conditions. For example, it doesn't even have to be blood pressure. It can be high cholesterol, diabetes, obesity, cardiovascular issues. Because as we all know, high blood pressure does contribute to those other health conditions I just mentioned. Now, it is likely that people with a family history of high blood pressure do share common environments and other potential factors that increase their risk. Some common health conditions that I did mention that go along with high blood pressure are diabetes, high cholesterol, and obesity. I just want to take a minute to talk about this. So, relating back to me and my family, high blood pressure and diabetes does run prevalent in my family. Both my mother and father have it. Great grandparents and grandparents definitely had it, and I do have some aunts and uncles that have it. Thankfully, right now, I'm not showing any signs of it, and I hope to keep it that way for as long as possible. Just because there's a family history of certain health conditions such as high blood pressure, diabetes, high cholesterol, or obesity, that doesn't mean you're develop it. It just means that you're at a greater risk for developing those health conditions. And these can be prevented, by making small lifestyle changes, such as, cutting out fats, not entirely, but just cutting them out to a minimum, like portion control, maintaining a healthy weight, just walking around for about 15 to 30 minutes every day will, do some good. You just have to keep your body active, in which we will talk about this in future videos because we're just going to stick to family history and genetics in this video, but this is just to get you to understand what I'm trying to convey with common health conditions. There are some other characteristics that can play a role. in developing high blood pressure, and these are age, sex, race and ethnicity, and lifestyle. Now, blood pressure tends to rise as you get older, so the risk for high blood pressure will typically increase with your age. According to the CDC, 9 out of 10 adults will develop high blood pressure in their lifetime. Sex. Well, this was actually no surprise to me, but both men and women are likely to develop high blood pressure at some point in their lifetime. There's no set that men are more likely than women or women are more likely than men. It's actually an equal thing. Race and ethnicity. So, anyone is susceptible to developing high blood pressure at some point in their life. However, African Americans are more likely to develop blood pressure issues than Caucasians, Hispanics, Asians, and other races. According to the CDC, compared with Caucasians, African Americans are likely to develop high blood pressure earlier in their life. So it may not happen at maybe 45 to 60. It could happen like in the early 30s or late 20s. You just never know. And as we all know, as I previously discussed, lifestyle choices can increase the risk for high blood pressure. It can only increase if you have a poor diet, lack of physical activity. But if you reverse those and improve adequate nutrition, get your body moving, you know, and de-stressing and other positive things for the body, then this will decrease your chances of developing high blood pressure. Just want to share a few things here. I call this knowing the warning signs, but it's a little ironic because high blood pressure typically has no warning signs or symptoms. And it's very common that many people do not know that they have high blood pressure. But I did want to list some symptoms that could occur that may signal that something really is going on, such as severe headache, blurred vision, chest pains, difficulty breathing, or some heart palpitations. If you experience any of these symptoms, it is very important to go get checked out because that means it might not only be high blood pressure or blood pressure issues going on, it may be an underlying condition that seriously needs to be checked out. So now that I've talked to you about family medical history and how this ties into blood pressure, some may ask, like, what can I do if I have a family history or you may have high blood pressure right now? Well, um, you should get checked at least once a year to make sure it is within the normal levels. As discussed in the first video, a normal blood pressure reading level is 120 over 80. And then there are some tips that you can do, such as reducing risk for the high blood pressure, which would be eating healthy foods, consuming less salt, exercising, and losing weight if needed. And if you're a current smoker, smoking does play a role in blood pressure. We will talk about that in another video as well. And if you're already being treated for high blood pressure, it's important that you take your medications that your doctor has prescribed for you. The doctor is not just giving you medicine just because. Obviously, if there is some blood pressure issues going on, this is to help to manage it and make sure it does not spiral out of control. And the point of this is just to be more vigilant about any health issues that are going on in your family. Like I mentioned in my family with high blood pressure, it really has, made me aware that I need to just be vigilant of what I'm eating and how much of it. Everything that we eat typically contains salt, but how much of it we consume is very important. And just a brief overview of what we've talked about today. Family members share genes, behaviors, lifestyles, and environments that can influence the health and their risk for diseases. High blood pressure can run in a family, and your risk for high blood pressure can increase based on age and your race or ethnicity. But just remember that just because there is a family history of certain medical conditions, that does not mean you're going to develop it. It just means you're at a greater risk for developing it. That's the key right there. And then the risk for high blood pressure can increase even more when heredity combines with unhealthy lifestyle choices such as smoking and eating an unhealthy diet. And as mentioned, I will talk about smoking and nutrition and another topic in future videos. But just for this one, we're just pertaining to family history and genetics. And this is just some references. Thank you so much, and I hope this video has helped you get a better understanding of family history and genetics and how it does play a role in blood pressure. Thank you.